Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we'll be talking about kidney disease, prevention and treatment. And joining me on the program is Dr. Baldeo Singh and Dr. Nandishaw Ramsingh. Welcome to the program, Dr. Ramsingh and Dr. Singh.
Thank you, Alicia. It's nice being here.
It's always good to have you guys. So today we're talking about kidney disease, prevention and treatment. And Dr. Ramsingh, I want us to start by allowing you to tell us about some of the progress that the ministry has made with regards to kidney care.
So, Alicia, the Ministry of Health, we have done a lot during the past 2 to 3 years. Actually, we've been able to implement a new dialysis assistant program. This is for our patients. They're able to receive cash grants that actually helps them with their dialysis care and their treatment. We have also been able to expand on some of our satellite clinics for kidney care in the regions. This is specifically to Region 2, Region 3, Region 6, and Region 10. We do work very closely with the Georgetown Public Hospital. Actually, on the show today, Dr. Baldeo Singh, he is one of the lead physicians that works along with us to have these kidney care clinics in the regions, because we really believe in reaching our patients. Our minister's vision is to be inclusive, to ensure that all of the patients that we have or the persons are receiving equitable care, and also be able to have optimal delivery of medication to them and their services. So what we're looking at is to lessen the burden of these patients that have to travel sometimes a very far away just to reach the Georgetown Public Hospital to get this care or to get this, ease of facility for their disease. So if they are able to reduce this cost to traveling and utilize this more towards their dialysis care, we believe that we're making or paving the way to a better path for their treatment and care.
Definitely. And you would have mentioned those satellite clinics within the region. Could you tell me how are persons responding to those the treatment and even to the services offered at those facilities?
So we have received some positive comments, definitely. Persons are happy that they don't need to travel the long amounts of time, especially from Region 2. And they are really looking forward to the continuity of these clinics and their dialysis care there. We've also been able to procure medication. This is the erythropoietin injection that is very costly for patients to buy. So for the last 2 to 3 years, we've been able to do this, and they have been able to access this at their centers in their regions.
Wonderful. I know many persons might be thinking, okay, how can I become a part of the kidney clinics? How is that done? What is the procedure should family members take to get their loved ones a part of that clinic if needed?
So that's a good question, Alicia. And what we've been doing, we've been encouraging regions, and actually one of our main innovative teachings here at the ministry is to expand training. And what we've been doing is try to train our healthcare professionals, because we know there aren't a lot of specialists in this field. So we're utilizing the specialists so that they can be able to do the trainings for these healthcare workers in the regions, so that they have the knowledge, so that they can be able to better look at patients who access care at the clinics and know when to put them into a specialized clinic, when they can be able to refer them if they need more care than the region can offer. So these are the small steps that we have in place so that we can be able to have a better outlook for our patients and know what our patient load is for these clinics.
Thank you, Dr. Ramsingh. With World Kidney Day approaching us on March 14th, could you tell us about some of the facts with regards to kidney disease? I know that this is an area that is very important, and we have heard all of the success stories about the kidney transplants coming out from GPHC. But could you tell us about some of the facts with regards to kidney disease? What should people know about this?
So we really want persons, and we know there are patients out there, but the population, we want you to know that, Kidney disease, it is real, it is here. You have complications or diseases such as diabetes and hypertension. It's going to lead you, if you're not controlling these diseases, or at least, taking care of yourself with your diets and so forth, it's going to lead you to developing one of these complications, which is probably chronic kidney disease in their lives. So we really want them to know. We really want them to be self-educated and also to educate others on how, these risk factors that we have and the diseases that we have can affect them or their loved ones. We also want them to know that a lot of times in the early stages of kidney diseases, this is the chronic kidney disease, you may not present with symptoms or signs, but this is why regular clinic visits and upkeeping your clinic visits is important. So these are just the few small areas. We also want persons to know that if you know someone that has a chronic illness such as diabetes or hypertension and they're not attending clinics, because in Guyana we have that issue. Persons know they're diabetics, they know they're hypertensive, but they just won't go to the clinics.
Yes.
We want to encourage, in our catchment areas, there are health centers. Go to your health center, upkeep your clinic date. We really want persons to be able to do their blood tests. Simple blood tests and urine tests, you can be able to tell if you have a chronic kidney disease or not. So these are just a few steps.
Thank you, Dr. Ramsingh, so much. We're going to go into a short break and be right back with more on kidney disease prevention and treatment.
Millions of people live with or are predisposed to type 1, type 2, and gestational diabetes worldwide. If you have diabetes, eating well, exercising, taking your medication, educating yourself on this condition, and knowing and managing your numbers can guarantee a healthy and fulfilling life, and delay or prevent serious health complications like heart disease, blindness, and kidney failure. Persons with diabetes should aim for a blood sugar level between 80 to 130 milligrams per deciliter before meals and less than 180 milligrams per deciliter 1 to 2 hours after meals. For anyone predisposed to diabetes, adopting healthy lifestyles is the key to delaying this disease's progression. That means eating well, exercising, maintaining a healthy weight, and getting screened regularly. If you are unwell, have high numbers, or want to learn more about this condition, visit your nearest health center. You can lead healthier and longer lives with our intervention and your adherence. A message from the Ministry of Health.
Dr. Singh, the theme for World Kidney Day this year is Kidney Health for All, advancing equitable access to care and optimal medication practice. Could you tell us what this means for Guyana?
Sure. Thank you, Alicia, for having me on this program. So we're focusing on having equitable care and optimal access to medications. So it means that, as you have discussed earlier, we're trying to focus more on reaching the population and spreading the clinics to the different areas, especially to where there is a big catchment area of patients. So by doing that, we provide the access to the patients. They don't have to travel to come to Georgetown or travel far distances, as well as what the ministry I know is trying to do is also to have the medications that they would need in the regions or the different areas, to have it taken to them at the hospital, so it's provided there. And the medications, the most expensive one, as Dr. Ramsingh would have mentioned, especially if they're on dialysis, would have been something that they use to help build their blood, right? Because when they have kidney failure and end-stage kidney failure, which is the last stage of kidney disease, and they're on dialysis, they need that because the kidney helps with helping with making your blood in the body, and the erythropoietin, as it's called, help to produce that. So it's an injection, and it's very expensive as well. So by providing that medication, helps decrease the cost for the patient, helps to decrease the transportation, helps to decrease the time in traveling, and also most of these patients are sick, so they'll need someone to accompany them. Yes. So it also helps with that. So overall, I think we're trying to meet the patient at their location, try to provide the care there, and this is in keeping with what the World Kidney Day is about.
We've been talking about kidney and prevention and treatment, but for those persons who are watching and they're not sure what is chronic kidney disease, could you explain this?
Sure. First, I think what the patient should know is that what is the function of your kidneys. So the kidneys, you have two kidneys in your body. The function basically is as a filter. So it filters the waste in the body. So basically, it gets rid of all the waste that you take in, as well as excess fluid. So in the form of urine. There's some other function like helping with your blood, helps to maintain your homeostasis in the body, and some other function. But the main thing is that it helps to filter the body of the waste products. So when you have kidney failure now, those functions become abnormal. So in what really happens is that you're unable to get rid of your waste products, and it makes you sick. You're not unable to get rid of the fluid, the excess fluid, and you start to notice swelling. The funny thing about kidney disease, though, is that there's 5 stages, and
Yeah.
as Dr. Ramsingh would have mentioned, stage 1, stage 2, stage 3 is unnoticeable, meaning that the patient might not even know that they have kidney disease, and they're already stage 3, right? So um, it is important to have follow-ups, especially given that the most common risk factor for kidney disease is diabetes. And diabetes is the leading cause of chronic kidney disease in the world, as well
Yeah.
as hypertension. But chronic kidney disease secondary to diabetes is the leading cause. And the thing is, once you're diabetic, for more than 12 to 15 years, you start to develop complications, especially even early if you have those disease uncontrolled, meaning that you don't take your medications, you eat whatever you feel like, you don't know how your sugar is. The same goes for hypertension. And with time, it causes damage, not only to your kidneys, but other organs, but the kidney is one of them. And I would say like 12 to 15 years, that's when you start to see the manifestations. And some patients present with kidney failure, right? And they want to know how they get kidney failure, but it's because they never took time to, take care of themselves, go to their clinics that's available in all the areas of the country, and have your regular follow-up done.
So then, especially for persons with diabetes, they need a total lifestyle change to prevent kidney disease. What are the types of kidney disease?
So there is what we call acute, right? Meaning that it happens when you're sick. Anybody can have that. Like let's say you get nausea, vomiting, diarrhea, or you develop dengue or some other form of illness, and you go to the hospital. There's like a 3 to 4% chance that you may develop acute kidney injury, but your kidneys usually recover from that. But then there's chronic kidney disease, which is usually secondary to some underlying problem. And as I mentioned before, the most common etiology would be, or the cause would be, diabetes and hypertension. What the other things that can cause it would be genetic. So sometimes in specific groups, you may find that they have like the father, the son, the daughter, they have kidney problem. They end up on dialysis. Then there's other diseases that can cause kidney disease as a manifestations. For example, autoimmune diseases. The most common would be lupus. There's also drugs that we use on a common day-to-day basis, especially the elderly population. They go over the counter, they buy ibuprofen, they buy diclofenac for joint pains, and then over a long period of time using they can also damage the kidney. And then there's horrible treatment that patients take that can also damage the kidney. So there's multiple things that can cause kidney damage and that leads to kidney failure.
For kidney disease, is there a specific age where persons can develop this, or it is more common at a later stage in life, probably your late 40s, 50s? Is there a particular age?
There is no age. There is no age. So there is pediatric causes, meaning in children. There is in your early teens, early 20s, early 30s. So most of the time, like early teens, early 20s in the children population would be mostly genetic. But as you get older, there's other diseases that you can get that would, even snake bite can lead to kidney failure, right? I have had a few
Yeah.
patients that had kidney failure from snake bite, from malaria, from dengue, So the common disease that you experience can lead to kidney failure because the kidney is one of the organs being affected very commonly because of all the other things that happen into your body. So, but in terms of chronic kidney disease, it would be, I would say, tortoise if you have type 1 diabetes and you have it for, like, let's say in your teens, but by the time you reach 30 or 40, you would start to have kidney disease, or even earlier. If you have type 2 diabetes and you got diagnosed in the 30s or 40s, by the time you reach 50 or in the 50s, you will be diagnosed with chronic kidney disease if these things are uncontrolled.
What can persons do to control their lifestyle habits so as to prevent kidney disease?
So the thing about kidney disease is that if you control the cause, you get to control the progression of it. The thing is, once you have kidney disease, you don't recover it once it's chronic. What you can do is slow the progression towards the end, which is when I say the end, is either you need dialysis or transplant when the kidney fails. And usually what happens after the age of 50 to 55, our GFR, which is the glomerular filtration rate, which we usually calculate to say, well, this is how your kidney is functioning or not, we tend to lose about 0.5 to 1 just with age. So adding that to, if you have an underlying cause that can lead to kidney disease, there is a possibility if you have diabetes diagnosed at the age of 40, by the time you reach 70, you may need dialysis, right, if it's not controlled. So having these risk factors is important to know. And the thing is, once you have kidney disease, you may have eye disease as well, because it comes hand in hand. Say at the same time, around 15 to 20 years, when you have kidney disease, your eyes are affected. And kidney disease also increases the risk of heart disease, right? And vice versa. Heart disease increases the risk of kidney disease. So you're talking about multiple things happening, and the major cause of death in kidney disease patients is heart disease. Yeah, so it's once you start with one, everything starts to stockpile on each other.
It's a lot to take in, Alicia. And we really want the persons out there to, focus on what Dr. Baldeo is saying, what we're sharing here today as well, because a lot of persons, we probably tend to overlook some of these diseases. Yes, we know about diabetes, we know about hypertension, but do we really know how we want to take care of ourselves? Do we really know, that it's necessary to actually control these diseases? Yes. So we really want persons to hear us and hear us clearly when we're talking about these diseases, because it's a lot.
A lot indeed. And I hope that our listening and viewing audience, they are paying keen attention to the information that you guys are sharing today. Dr. Singh, you mentioned dialysis, and I know this is usually needed in the end stage of kidney disease. How does this work, and what is it like taking dialysis for those persons who don't know and persons who are still yet to curb, their lifestyle habits and, adopt more good practices?
That's a very good question. So dialysis, when I explain to the patients, I usually tell them it's life support. So, like when you get sick and you can't breathe, you need to put you on the ventilator. They call it life support. Dialysis is basically the same thing. It's just that you do it in an outpatient setting, meaning you can go home, come back, and get it. So basically what dialysis is, when the kidney fails, all the toxins that's built up there, you can't get rid of it. So dialysis basically filters the blood for you, right? Cleans it, gets rid of the excess toxin and fluid in the body. So most of the time it's done. There's two types of dialysis. There is the one that you do in the blood, and there's also one that we call peritoneal dialysis that patient can actually do at home. This is not very big in Guyana, but it's something that we're hoping that we can improve on, where patients have the possibility of doing it at home, and it's free of cost. There's no cost attached to it. However, the hemodialysis, which is the one that you do in the blood, you have to pay the center that you go to. So you do it. In terms of how it affects your life, you have to do it at least the recommendation is 3 times per week, 4 hours every time. But most of the time, most patients do it 2 times per week, and it's done at the center, out of the hospital. Most of the time, how it happens is that the patient gets sick or they need to start dialysis. They go to Georgetown Hospital. We started there. They get at least 3 sessions, make sure everything is okay, and then they go out of the hospital and they start it at the center. The cost varies per different centers, and as Dr. Ramsingh would have mentioned, there is some help from the government that helps the patient. But to take it into perspective, 3 times per week, 4 hours per session, that's recommended. To travel takes half hour, and then most patients, they're very sick at the end of it, right? Because basically you have every minute about 250 to 300 mils of blood that's being cleaned. It's going from your body into the dialysis machine and then return. So after a process like that, you're weak and tired, right? Yeah. So, to prevent it, it's very simple. Control the things that can be controlled, which is diabetes, hypertension. Some of it, like genetic causes and so on, you cannot prevent. But the things that are very common, we can try to prevent, or at least try to slow the progression of it.
Definitely. Thank you, Dr. Singh. Dr. Ramsingh, you mentioned earlier that it is important for persons to visit their health centers and their clinics and ensure that they get screened. Could you stress a little bit more on that? Because I know that the ministry has been pushing prevention a lot. Could you stress on that for those persons who may have joined the program late?
Yes, so Alicia, it's very simple. You feel ill or you don't feel ill, still go to a health center that's nearby to you. When we talk about screening, especially in kidney diseases, a simple blood test and a urine test, it's all it takes, especially if you're a diabetic or a hypertensive. You do your regular checkups. You advocate for yourself, self-advocation to your doctors or healthcare workers that are there. You would like to get your test done every 6 months, it's recommended. But ensure that you just have this simple blood test that looks at your kidney functions, and that's how we're able to tell that, okay, maybe we're seeing some problems in your kidney. This is how we can be able to calculate, like Dr. Baldeo say, the stages that you can find in kidney disease. This is how we'll better be able to treat you and to probably advise you on a better course, pathway course on what you need to eat, what you need to do, the amount of exercise you might need. So it's very simple steps, but we really want persons to come out to their health centers. If they're with a chronic illness, which is a long-lasting illness, we really want you to come keep your dates up. Advocate for yourself at your workplace. If you know you have a clinic date, stick to your clinic date, because this can be probably the one day that defines if you're, with chronic kidney disease or you're with another chronic illness.
How can a family member support a loved one who may have a kidney disease or may be undergoing kidney transplant? How can they provide support to that person during that entire process?
So family support is very much needed, knowing that the persons in your household know about your disease. So this is basically teaching others about what you have, or the persons in the family reaching out to their physicians or their healthcare workers to educate them a little bit more about what the disease is. And the little steps, knowing how to cook their meals, knowing that you need to probably have less salt, less processed foods in the house. These are the few steps that you can be able to support them. A lot of time it's mentally draining as well. So sit with your family member, encourage them, let them know that, you're trying your best. There is effective treatment out there. Encourage them to take their clinic days. If they're a dialysis patient, encourage them through their dialysis period, because it's very hard. Like Dr. Baldeo say, it's long hours that they need to be there. So emotional support as well would go a long way in these patients.
Thank you, Dr. Ramsingh.
Hypertension, commonly known as high blood pressure, is when the pressure in your blood vessels is too high. It is common, but can be serious if left untreated. People with high blood pressure may not feel symptoms. The only way to know is to check your blood pressure. Consistent blood pressure readings at 130/80 mmHg are considered high hypertension. The first number represents pressure during heartbeats, while the second represents pressure when the heart rests. Risk factors like certain health conditions, lifestyle, age, ethnicity, and family history can increase your chances of developing high blood pressure. By lowering your blood pressure with exercise, a healthy diet, reducing stress, not smoking, and limiting alcohol and sodium intake, one can delay the progression of high blood pressure. For those persons already living with the condition, it is important that you take your medication as prescribed by a doctor. If you feel unwell, have high numbers, or want to learn more about hypertension, visit your nearest health center and always remember to check your numbers. A message from the Ministry of Health.
Dr. Singh, we're still on the aspect of prevention, and I want us to touch a little bit on kidney transplants. When is this needed and how is it done?
All right. So kidney transplant is usually when, as we know it, the kidney is failed and it's at the end stage, stage 5. So there are what we call the options for treatment in kidney failure would be renal replacement therapy. And there are 3 options, as I mentioned before. It would have been dialysis, which is divided into 2, hemodialysis and peritoneal dialysis. And then there's kidney transplant. Now, ideally, what we offer in Guyana is live-in donation or live-in kidney transplant. So, but there is different types of kidney transplant. So there is live-in and there is deceased, meaning that we take it from someone who wanted to be a donor when they're like neurologically dead, and we take that organ and transplant it on someone else. And then there's a living where you have a donor, and you know it could be a relative or someone who wants to donate to help someone else. So kidney transplant is one of the best options. Ideally, if it's a living donor, you wanted to do it preemptive, meaning before the patients need dialysis. Right, so that way you preserve whatever kidney they have left, and you give them a longer lifespan. So usually, if you have a kidney transplant, it would last for like 15 to 20 years. Usually, once the patient is compliant with all their medications, all their follow-up, and so on. First is dialysis. Dialysis is less; it's half of that. Right? It could go longer. There's patients that live 20 to 30 years on dialysis, but the common range would be around 8 to 10 years of post-starting dialysis. So transplant is the ideal way to go. And I know for sure that the Ministry of Health is, other than, because live-in donation or live-in kidney transplant is, you have to find a donor.
Yes.
But if you also have deceased donor, that would give the patients who don't have a living donor the options of having a kidney transplant, and they're working on that. They have the committee set up to start it. They're in the process of setting everything up. So hopefully, very soon, maybe the end of this year, or hopefully in the near future, we can have that to offer our patients as well.
Definitely. Thank you guys for joining me on the program today. It has been very informative, and I do want to encourage you to keep up the good work that you've been doing at your various departments.
Thank you so much, Alicia.
Thank you.
Thank you for staying tuned with us today on the program. I'm Alicia Martin saying goodbye for now.